Our group decided to break down the football punt. The football punt is primarily used on fourth down during the game if the offense is not in field goal range. The purpose of the punt is to pin the opposing offense as deep in their own territory as possible, so that they begin their offensive drive with the longest possible field ahead of them to score. The phases being analyzed include the stance, preparatory, movement, follow-through, and recovery phases. The joints being analyzed include the scapulothoracic, glenohumeral, elbow, radial ulnar, wrist, hand, pelvic girdle, hip, knee, and ankle joints. During the stance phase, the punter is motionless, yet his muscles are contracting isometrically so that he is in the proper position before entering into the preparatory phase. The left and right upper extremities are symmetrical during this phase, so the same actions are occurring at the same joints on both sides. The scapulothoracic joint, there is protraction and upward rotation to accompany the flexion and internal rotation occurring at the glenohumeral joint. The agonist muscles for scapulothoracic protraction include the serratus anterior and pectoralis minor. For scapulothoracic upward rotation, the agonist muscles include the upper, middle, and lower trapezius, as well as the serratus anterior. The agonist muscles for glenohumeral flexion include the anterior deltoid, upper pectoralis major, and coracobrachialis, and for glenohumeral internal rotation include the latissimus dorsi, teres major, subscapularis, pectoralis major, and anterior deltoid. There is flexion at the elbow, and the agonist muscles include the biceps brachii, brachialis, and brachioradialis. At the radioulnar joint is supination, and the agonist muscles include the biceps brachii, supinator, and brachioradialis. Although the wrist joint is not in a flexed position, the wrist flexors are contracting in addition to the finger flexors to keep a grip on the ball. The agonist muscles for wrist flexion include the flexor carpi radialis, flexor carpi ulnaris, and palmaris longus. The agonist muscles for the flexion of the fingers include flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. There is also abduction in the MCP joints in the hand, and the agonist muscles include the abductor pollicis longus, as well as various intrinsic muscles in the hand. Left and right lower extremities are also symmetrical during the stance phase. At the pelvic girdle, there is anterior tilt. The agonist muscles include the tensor fascia lata, rectus femoris, iliopsoas, quadratus lumborum, and the erector spinae. There is flexion at the hip, and the agonist muscles include the tensor fascia lata, rectus femoris, iliopsoas, pectineus, and sartorius. The knee is in extension, and the agonist muscles include the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. There is dorsiflexion at the ankle, and the agonist muscles include the peroneus tertius, extensor digitorum longus, extensor hallucis longus, and tibialis anterior.
During the preparatory phase, the punter is stepping into the punt. The upper extremities are symmetrical again during this phase. There is concentric scapulothoracic protraction using the scapulothoracic protractors and upward rotators. There is concentric glenohumeral flexion and internal rotation using the glenohumeral flexors and internal rotators. There is eccentric elbow extension to resist gravity using the elbow flexors. At the radioulnar joint, there is isometric supination using the radioulnar supinators. There is still isometric flexion of the wrist and fingers as well as abduction of the metacarpal joints to hold the ball. These actions use the wrist and finger flexors and the hand abductors. The lower extremities are not symmetrical during the preparatory phase. Starting with the left, there is concentric anterior tilt using the anterior pelvic rotators. There is concentric hip flexion using the hip flexors. There is concentric knee extension using the knee extensors. At the ankle, there is concentric plantar flexion. The agonist muscles include the gastrocnemius, soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, peroneus longus, and peroneus brevis. Turning to the right side, there is concentric anterior tilt using the anterior pelvic rotators. There is concentric hip extension using the biceps femoris, semimembranosus, semitendinosus, adductor magnus, and gluteus maximus. There is concentric knee flexion using the biceps femoris, semimembranosus, semitendinosus, and popliteus. At the ankle, there is eccentric dorsiflexion resisting the body moving forward using the plantar flexors.
Alright, now I'm going to talk about the movement phase. During the movement phase, the punter is punting the ball. Starting with the left upper extremities, there is eccentric scapulothoracic elevation using the pectoralis minor and lower trapezius. There is also isometric scapulothoracic upward rotation and protraction using the scapulothoracic upward rotators and protractors. There's concentric glenohumeral abduction using the deltoid muscles and the supraspinatus. There's also isometric glenohumeral flexion and internal rotation using the glenohumeral flexors and internal rotators. At the elbow, there is eccentric extension using the elbow flexors. There is concentric radio-ulnar pronation using the pronator quadratus, pronator teres, and brachioradialis. There's concentric wrist extension using the extensor carpi radialis longus and brevis, extensor carpi ulnaris, extensor digitorum, extensor indicis, extensor digiti minimi, and extensor pollicis longus and brevis. There's concentric finger extension using the extensor digitorum, extensor indicis, extensor digiti minimi, and extensor pollicis longus and brevis. On the right, there is eccentric scapulothoracic elevation using the scapulothoracic depressors, along with concentric retraction using the rhomboids, middle trapezius and lower trapezius, and concentric downward rotation using the pectoralis minor and rhomboids. At the glenohumeral joint, there is concentric extension using the latissimus dorsi, teres major, teres minor, infraspinatus, subscapularis, concentric abduction using the glenohumeral abductors, and concentric external rotation using the posterior deltoid, infraspinatus, and teres minor. There is eccentric elbow extension using the elbow flexors. There is no movement at the radio-ulnar joint. There is concentric extension of the wrist and hand joints using the wrist flexors and finger flexors. Now to talk about the lower extremities. At the left lower extremity, there is eccentric lateral pelvic tilt and posterior tilt using the anterior pelvic rotators. There is eccentric hip extension using the hip flexors. At the knee, there is eccentric flexion using the knee extensors. There is concentric plantar flexion at the ankle using the plantar flexors. On the right, there is concentric anterior pelvic tilt using the anterior pelvic rotators. There is concentric hip flexion using the hip flexors. There is concentric knee extension using the knee extensors. There is concentric plantar flexion at the ankle using the plantar flexors.
In the follow-through phase, the punter is slowing his body down after kicking the ball. Starting with the left upper extremities, there is eccentric scapulothoracic depression using the scapulothoracic elevators, along with isometric upward rotation using the scapulothoracic upward rotators, and isometric protraction using the scapulothoracic protractors. At the glenohumeral joint, there is isometric flexion and internal rotation using the glenohumeral flexors and internal rotators. There is eccentric elbow extension using the elbow flexors. There is no movement at the radio-ulnar joint. There is isometric wrist and hand extension using the wrist and hand and finger extensors. On the right, there is eccentric scapulothoracic depression, upward rotation, and protraction using the scapulothoracic elevators, downward rotators, and retractors. There is concentric glenohumeral horizontal adduction using the pectoralis major, coracobrachialis, and anterior deltoid, as well as concentric internal rotation using the glenohumeral internal rotators. There is isometric extension of the elbow using triceps brachii and anconeus. The radio-ulnar joint remains neutral. There is isometric extension of the wrist and hand using the wrist and finger extensors. Looking at the left lower extremities, there is isometric anterior tilt of the pelvis using the anterior pelvic rotators. There is concentric flexion of the hip using hip flexors. At the knee, there is concentric extension using knee extensors. At the ankle, there is concentric plantar flexion using the plantar flexors. On the right, there is isometric anterior tilt of the pelvis using the anterior pelvic rotators. There is eccentric extension of the hip resisting the force of gravity as the leg moves down, using the hip flexors. There is eccentric flexion of the knee for the same reason, using the knee extensors. At the ankle, there is isometric plantar flexion using the plantar flexor.
During the recovery phase, the punter is slowing to a stop so that he is in a ready position to run down the field if need be. The left and right upper extremities are symmetrical during this phase, so the same actions are occurring at the same joints on both sides. The scapulothoracic joint, there is eccentric depression, downward rotation, and retraction by the scapulothoracic elevators, upward rotators, and protractors, as they resist gravity as the scapulothoracic joint contracts. There is eccentric extension, external rotation, and abduction occurring at the glenohumeral joint by the glenohumeral flexors, internal rotators, and adductors, as they also resist gravity as the glenohumeral joint contracts. There is eccentric extension at the elbow, so the agonist muscles include the elbow flexors as they resist gravity as the elbow contracts. The radio-ulnar joint remains neutral during this phase. The wrist joint stays in isometric extension, using the wrist extensors. There is an eccentric ulnar deviation as well, which the radial deviators are resisting gravity as the wrist contracts. These include the flexor carpi radialis, extensor carpi radialis longus and brevis, abductor pollicis longus, extensor pollicis longus and brevis, and flexor pollicis longus. The fingers stay isometrically extended using the finger extensors. The left and right lower extremities are not symmetrical. On the left, the pelvic girdle is tilting posteriorly concentrically using the posterior pelvic rotators. There is concentric hip extension and knee flexion using the hip extensors and knee flexors, respectively. There is concentric plantar flexion at the left ankle using the plantar flexors. On the right side, the pelvic girdle is tilting posteriorly eccentrically as the anterior pelvic rotators resist the force of the body entering into posterior pelvic rotation. There is eccentric hip extension as the hip flexors are contracting to resist the hip entering into extension. The right knee is extending isometrically using the knee extensors, while there is eccentric dorsiflexion of the ankle as the plantar flexors of the ankle contract to resist the ankle going into dorsiflexion. In conclusion, the football punt requires multiple different actions at different joints, using various different muscles throughout. Again, it is used on fourth down during a game to pin the opposing offense in their own territory, giving them the longest amount of field possible ahead of them in order to score. The actions of supination and pronation at the radio-ulnar joint and internal and external rotation at the glenohumeral joint are the main actions using the transverse plane along the longitudinal axis. Any action requiring flexion and extension, as well as the posterior and anterior tilt at the pelvic girdle, use the sagittal plane along the frontal axis. The frontal plane along the sagittal axis is used during any abduction or adduction, as well as various scapulothoracic actions, including elevation and depression, upward rotation and downward rotation, and protraction and retraction.